Hello friends, I am Rashmi. Welcome to SRS Info. Today we will discuss about the topic Determinants of Health under Health Education and Community Pharmacy. See, what are the determinants of health? Actually, the health is influenced by a number of factors which exist within the individual and the society. And these factors which influence the health of an individual directly or indirectly, these factors are called the determinants of health. Okay. Now, what are these determinants of health? Mainly, the factors which affect the health of an individual are heredity, environment, lifestyle, socio-economic conditions, health services, and health-related systems. These are the main determinants of health. Now, let us discuss these determinants in detail. The first one is heredity. What is heredity? The characteristics of an individual which are carried to the next generation. These are heredity. Okay? And this heredity is determined by the genes. Genes determine the health of an individual from the moment of conception. When the embryo is generated within the body, from that time, from the moment of conception of the embryo, the genes start to determine the health. Why? Genes are the heredity carrying factors. So, if an individual has any health related issues, the hereditary diseases, there is a possibility of getting these diseases into the child. So, this genetic makeup cannot be altered. The genetically transferred conditions cannot be altered. The health of an individual depends on his or her genetic constitution. What is the genetic constitution of an individual? This genetic constitution plays a very important role for the maintenance of health. Okay? Diabetes, mental retardation, these types of diseases can be transferred from one generation to another generation. So that heredity of an individual plays very important role for maintaining and carrying the health, and hereditary conditions plays very important role in the transferring of health to the coming generation. Okay. The next one is environment. What is environment? The all internal or external condition where we live together we can call it as environment. Okay. And this environment also plays very important role in our health. Diseases are mainly caused by the changes in environment like air, water, climate, etc. If there is any change in these environmental factors, it will adversely affect our health. Okay. In the concept of health, there are mainly two types of environment. What are they? One is internal environment. The next one is external environment. Internal environment means the internal condition of our body system, which is related to the tissue, organ and system of the body and their harmonious functioning. What is the situation? What is the condition of the health of our tissue and organ and the body as a whole and their harmonious functioning of all these organs? This we can call as internal environment. How do these organs function? All those factors which affect the functioning of our body, functioning of our tissues, specific organs, we can call it as internal environment. Okay. If there is any disturbances in this internal environment, will adversely affect our health system. Then external environment, what is it? This is the physical, biological and psychological components to which an individual is exposed. All those factors which affect the physiological, biological and psychological conditions of our body, of our health, we can call as external environment. So both this internal and external environment plays a very important role in the maintenance of health of an individual. Environment has a direct influence on the physical, mental and social well-being of an individual. Okay, the internal environment and external environment. Both of this environment are very important for the health of an individual. The third one is lifestyle. What is lifestyle? The way people live. We can call it as lifestyle. Nowadays, most types of diseases are generated by the unhealthy lifestyle. So, lifestyle is very, very important. Lifestyle includes culture, behavior, and also some habits like smoking, alcoholism, etc. Lifestyle means culture of living, and the behavior, how we behave, how we control our emotions, how we manage our emotions, and then the habits. It's not naturally occurred, okay? The habits we are creating. We are creating some habits, we are practicing some habits for just a temporary enjoyment. But after some time, the habits will conquer us. That habits may include smoking, alcoholism, etc. This we start for a temporary enjoyment, but after some time, without these habits, we cannot lead our life. So these habits manage the style of our life, the way of living. So this will lead to a bad habit which lead to bad health. So good lifestyle is very, very important. For that we need good education, good practice, good counseling, etc. Good lifestyle is the base of good health. These good lifestyle include good food, good sleep, and good exercise, which promotes better health. So good lifestyle promotes good health. Some of the most common lifestyle diseases include heart disease, cancer, diabetes, etc. All these types of diseases can be categorized as the lifestyle diseases. But one of the most important thing is the diseases like diabetes can be transferred from one generation to another. So our unhealthy lifestyle may adversely affect the health of the coming generation also. So we have to take care of our health and we have to take care of our lifestyle. Okay. Next one is socio-economic conditions. You may think that how does this socio-economic condition affect the healthy life of an individual? Yes, socio-economic conditions plays a very, very important role, a crucial role in the maintenance of health. What are the socio-economic conditions? These include income, education, nutrition, employment, housing, etc. And see, all these factors are very, very important for the healthy living. Now, let us discuss in detail about this. What is the role of income? Rich people have a capacity to seek better health care. Rich people have income. So, if they are diseased, there is an option to go to hospital and take proper treatment. If a person does not have proper income, so he never think about the maintenance of his health. He may think about the minimum needed food, okay, not more than that. So rich people have a capacity to seek better health care, so they are healthy because they have resources. But at the same time, you have to notice that they are comparatively inactive and sedentary. This may lead to lifestyle diseases. They have enough resources to lead luxury life, so there is a possibility to become inactive and sedentary. So they are prone of lifestyle diseases like heart disease, diabetes, obesity, etc. So only becoming rich is not the indicators of good health, but income is very important for getting or seeking better health care. Okay. The next one is education. It's very important. Education, especially female education, has an influence on health. Education helps people to understand the importance of clean environment and good health. The main thing is awareness. It does not mean that you have to take a degree. The thing is how we can convince, how we can make our society aware about the good health practices, clean and healthy environment, hygienic conditions, etc. For that, we need basic education system based on this healthy conditions. We need basic education, and that basic education should be based on healthy conditions, hygienic environment, etc. Educated people can give more awareness and more education to society, their family, their relatives, especially girls, etc. And girls' education, women education plays a very important role to make them healthy by themselves and to keep their children healthy. And only in this way we can make a generation with full of health and energy. Nutrition, rich food, healthy lifestyle, and energetic body, exercise, all these factors can come into the practice of our life only by awareness, and this awareness can get only by education. So education is one of the most important socio-economic factor which determine the health. The next is nutrition. Again, if we are aware about these things, then only we know about what is the importance of nutrition. By taking one type of food 3 times or 4 times in a day cannot make us healthy. Most of the time, the rich or luxurious lifestyle will lead to obesity. Why? Because a single type of or similar type of food is taking continuously without changing it, because nowadays children are interested with junk food. They are taking food, but it is not healthy. Nutritious rich food plays a very important role. And also in the case of poor people, think about them. They don't have choice. Rich people have choice, but they don't choose. But poor people have no choice. There is no option for choice. Both these conditions will lead to lack of nutrition, which again lead to the unhealthy society. The individual health leads to the social health. If the individuals are not healthy, then how we can create a society with health? So, poor and rich people, both these categories should take care of the intake of nutritious rich food. Starvation has an adverse effect on health. So, good nutrition is essential for normal growth and also for resistance against infection. See the point. Resistance against the infection can be get from how we can develop, how does the body develop the capacity to resist against infection? By vitamins, okay, and other type of proteins. This nutrition, from where the body gets this nutrition? From food. So nutritious rich food is very important. Both these poor and rich categories of the society should take care of this. For this purpose, we need education and awareness. Okay? And good nutrition is very essential for normal growth and also for the resistance against infection. And this resistance makes the body healthy. So nutrition is very important. Then occupation. See, employment provides income. If there is no income, there is no question of health. Employed people enjoys good health. Why? Because they have income. They can go to hospital if needed. Due to lack of income, unemployed people do not have the access to good health care. Unemployed people do not have income, and due to lack of income, they do not have this access to good health care. So these are the main socio-economic factors which affect the health of an individual. The next one is health services. Now we have seen that what are the socio-economic factors, socio-economic conditions which affect the health. So the government has taken some initiative for the promotion of this health, to give nutritious food to women and children and make them more aware about these things, and provide income to the poor people so that they can take care of their life along with the health. For this purpose, government has taken many initiatives. So the main aim of this health and family welfare services is that to treat the diseases, prevent illness. The best way is prevent. Prevention is better than cure. So the health services are based on this prevention. Okay. So the health and family welfare services mainly focused on the prevention areas where we can prevent the possibility of getting diseased. To treat diseases, prevent illness and promotion of health. Of course, if we try to prevent the possibility of occurring this disease, we can promote health. Then health services like water supply, immunization, etc. prevent a variety of diseases. Pure, good water supply to all people who need it. This plays a very important role to prevent many types of diseases, and timely immunization. For this purpose, we have to make aware the mothers. So women education, creating awareness among mothers are very important to get proper immunization to kids at the proper time. Okay, so these are coming under health services. So proper and good quality health services are one of the important determinants of social health. Then other health related systems. What are other health related systems? Like agriculture, industry, rural development, employment, all these things have a very important impact on health by raising the standard of living. So how we can improve the standard of living, the overall development of an individual by which he can support his own life and his family and his society. These are coming under the overall development, that is all the health related systems together, that is the development in agriculture, industry, rural development, employment sector, education sector. The development of all these sectors together can play a very important role in improving the standard of living of individual, by which we can improve health standard of our citizen. So these are the main determinants of health. I hope you enjoyed the video. In the next class we will discuss about the indicators of health. Thank you.